There are a lot of different causes of pelvic pain, and there's never just one cause of pelvic pain. Many times there is more than one or two, three, four causes in someone who presents with pelvic pain, and it spans all organ systems. It goes from vascular, urological, gynecological, musculoskeletal, neurological, dermatological, and so it becomes really difficult to assess someone with chronic pelvic pain because it could be so many different causes. Yeah, so my practice is dedicated in evaluating and treating women with chronic pelvic pain. And so most of my referrals will come from primary care or gynecologists who have seen those patients and unable to identify what may be causing their pain or having trouble with controlling their pain, and those patients are referred to me. So it's estimated about 15% of all women will have experienced chronic pelvic pain. And there's some statistics that say that about 35% of patients who go to a primary care office will have chronic pelvic pain. The first step is having a really comprehensive evaluation and a very thorough history. So we start to talk about, well, for instance, a lot of these patients had pain for many years, and so one of the things I always like to ask is, so how did all of this begin? What were your first type of symptoms that you were having? And try to create a picture of what has happened with the patient since you first started having symptoms to now a patient who's just having pain all the time and having a lot of different symptoms. And so that takes, 30 minutes of a conversation and obtaining a history. And then from there on, it's a comprehensive examination trying to identify pain sources or pain triggers and examination. We also work with physical therapists and PM&R physicians who will evaluate the patients for musculoskeletal conditions. And so we do a very thorough and comprehensive evaluation of them to try to identify what could be the reasons for this patient's pain. So I think that what's important when we continue our studies in women or men who have chronic pelvic pain is to focus more on identifying sources of pain, to identifying phenotypes of the patients, because everybody is different in their experience of pain, and not everybody is going to respond to certain treatments. And I think if we focus our studies in identifying subtypes of patients who have chronic pelvic pain, we can then begin to actually formulate better treatment options and studies and medications for them.